Good afternoon, everyone. This afternoon we'll be taking a look at the reports for the cholecystectomy episode. PAPs will be provided tools to help measure and improve patient care. One of the most important tools is the provider reports. These reports are key to keeping up with your performance relative to each episode and show your eligibility for gain and risk sharing. The reports provide performance information for PAPS episodes, such as an overview of quality across the PAP episodes, overview of cost effectiveness, how a PAP is doing relative to cost thresholds and relative to other providers, and also an overview of utilization and drivers of a PAP's average episode of cost. The PAP performance reports have summary results and detailed analysis of episodes' cost, quality, and utilization. The guide to reading your reports is available online, and reports are also available via the provider portal. Reports are issued quarterly. Now, the delay between the reporting period and the availability of reports on the provider portal is due to the time required for claims to be submitted for services provided. There will be 3 months for 95% of the claims, and the time required for claims algorithms and quarterly reports to be processed is 1 month. The first page of the report will give you the date of the report and the date range of the data included in the report. It will also tell you if this is a historical report or an actual performance report. Please note the disclaimer at the bottom of the page, which states, the information contained in these reports is intended solely for the use of administration of the Medicaid programs. The data in the report is neither intended nor suitable for other uses, including the selection of the healthcare provider. The figures in this report are preliminary and are subject to revision. For information, please visit the website that we have listed, thepaymentinitiative.org. The second page of the report is a letter from Andy Allison, our Medicaid director. There's a lot of useful information in this letter regarding the Arkansas Payment Improvement Initiative, so I would encourage everyone to read this letter. One section of the letter that I would like to bring to your attention is in the 4th paragraph, where it will state in this section, the first sentence, he will tell you if this is a preparatory phase or actual performance phase. I realize that you're starting to view many of these reports, and sometimes it's a little hard to keep them straight, so this is another way that you will make sure if you're looking at actual historical or actual live performance data. The third page of the report is the table of contents, and this page will list all episodes for which you are considered the printable accountable provider or the PAP. Now we're going to look at the first page of the report. This is going to look a little different than earlier reports in the performance summary. I believe it's a little bit easier for you to read at a glance. Again, it will list episodes for which you are considered a PAP. Going across the top columns of the page, you will show the episodes of care. The next column will be the quality. It will show if you met or not met the episode. The next column is your average episode cost. It will show acceptable, not acceptable, or commendable. Then you will have your gain or risk share, whether you are not eligible for gain sharing, will receive gain sharing, or subject to risk sharing. The last column will show the amount. If you are subject to risk sharing, it will be highlighted in red. Please note at the last line of this page, it gives you a summary of your gain or risk sharing across all episodes for which you are a PAP and tells if cost of stop loss will be applied. The next slide is going to be your summary page. This will be the same format for all episodes of Wave 2. The first section is the overview, which shows the total number of episodes as 262. The total number of episodes included as 233, and the total numbers of episodes excluded is 29. The second section shows the cost of care compared to other providers ranging from commendable to not acceptable. The individual provider will be indicated by a dark blue diamond. It will also show the gain and risk share amount for the episode. The third section is the quality summary. On one side of the black line will be a graph or graphs depending on the quality metrics for each episode. The quality metrics are the ones linked to gain sharing. If the episode requires quality data to be entered in the portal, it is very important that you enter the required data into the portal, as even if you are in commendable cost range and do not meet quality metrics, you will not be eligible for the sharing. You should be able to key quality metrics in the provider portal by October 1st. Please note the black line in the graph represents the maximum threshold you must be below this line to qualify for gain sharing for this episode. On the other side of the center black line will be quality metrics that are being tracked but not linked to gain sharing. In the fourth section is the cost summary. There are several graphs in this section of the report that will be useful for you in assessing your performance. The first graph is your total cost overview. The graph next to it is the average cost overview and compares your average cost to that of other providers. In this example, the provider's average cost is just a little higher than the other providers, but still is in the acceptable range. The graph in the middle of the section shows you cost distribution. In this example, the provider had 23 beneficiaries in the 1,449 to the 1,581 cost range, which is commendable. 23 beneficiaries in the 1,919 to the 5,142 cost range, which is not acceptable. And then they had 84 beneficiaries in the 1,694 to 1,806 cost range, which is acceptable. So look closely at this graph on your report. It will help you see where the majority of your beneficiaries are falling, and maybe take a closer look at the ones falling in a higher cost range. The last graph of this section shows the provider where they fall in distribution range. The provider is shown with the dark blue line on the reports. On here it might be a little hard to see, but it's going to be a dark blue line to show you where your provider is at. The fifth section of this page will deal with the key utilization metrics, which may vary according to the episodes of care. For this episode, we are looking at the number of episodes converted from laparoscopic to open and the number of episodes initiated as open. This gives the provider a look at how they are performing in relation to other providers and where they may have areas of opportunity for improvement. The next slide is the quality and utilization detail, which shows the provider what percentile they fall in relation to quality and utilization metrics. Notice how the highlighted line in section 1 is the quality metrics that link to gain share, and the provider would have to be over the black bar in order to participate in the gain sharing. The last page of the report we're going to look at is the cost detail. Like previous reports, it will break down the cost categories associated with the episodes of care. This gives the provider the opportunity to see where they are in relation to other providers, where they are doing well, and also where they have areas for improvement.